Welcome to Community Health Matters. I'm your host, Amy Marsalis. On today's show, we'll learn about infant and early childhood mental health, sun safety, and childhood obesity and diabetes. All of that coming up next on Community Health Matters. From the News Channel 5 network, this is Community Health Matters, sponsored by the United Health Foundation. Skin cancer is the most common cancer in the United States. In fact, you could add up all the other cases of cancer together, and skin cancer still affects more people than any other type of cancer, correct?
That is
Dr.
correct,
Wandass?
Amy. Yes.
Good to have you here.
Thank you for having me.
Are the numbers, have you seen a decline since there's been more awareness, more campaigns about skin cancer?
No, in actuality, the numbers are increasing.
Really?
Yes, throughout the world. And that may be due to a number of factors, but some of that may be due to depletion of the ozone layer, because ozone helps to absorb ultraviolet radiation, which is the entity that damages skin. So we've seen numbers increasing. All right.
Tell me about the most common, let's go through the list of skin cancers, because I know there are varying degrees. Obviously you hear melanoma, and that's a very scary diagnosis, can be in many cases. So can you go through the list?
Yeah, there are two major forms of skin cancer. There's melanoma, which you've already mentioned, and non-melanoma. And non-melanoma is divided into basal cell and squamous cell. The various percentages of them are, for squamous cell, around 16%, basal around 80% most commonly, and then melanoma around 4%. And they vary. The reason that we label them differently is based upon where they are found in the skin. So melanoma occurs in the pigment-containing cells at the base of the skin.
So further down?
Yes.
Deeper?
Deeper, yes.
Okay. Basal cell is more of a surface superficial?
It's at the bottom of the epidermis, and then squamous on the top, higher up.
Squamous is higher up.
Yes.
Okay, I was thinking it was the opposite, basal cell higher up. Okay, I may be jumping ahead. Let's talk about, in general, how you approach patients and diagnosing skin cancer and looking for it in early stages, who may be most at risk.
When I see a patient coming in, there are a number of factors that I consider when I'm sitting down for that first office visit. Typically, we'll look for a fair-skinned individual, maybe someone from Northern European extraction, like Scandinavian countries, light eyes, red hair. These people are at increased risk of sun damage leading to skin cancers. I'll also ask about occupation. So if you're in construction, if you're doing landscaping, if you have a lot of recreational activities that involve you being outside, then it's very important to protect yourself from the sun.
All right. So if you have darker skin, more olive skin, you know, your background is more of a Mediterranean, or even if you're African American, you're not as high as at high risk.
Correct. You have a lower risk, but the risk is still there.
It's still there.
Yes, because there's really no minimum acceptable amount of ultraviolet light that you should be exposed to.
Not just a little color, right? No. That's not, you always hear people say, okay, I just want a little color.
I just want a little bit of a base tan. But you know, people who have, for instance, what I mentioned before about having red hair, light skin, and lighter eyes, they can begin to have sun damage in 5 to 10 minutes being outside.
Oh my goodness. Now, if you've had a burn, you had a burn when you were a kid.
Yes.
And you're now in your 40s or 50s. So what are the chances that you're going to develop something as you get older from
blistering, yes, burns. Cumulative burns, multiple burns, especially blistering burns in childhood, are associated with an increased risk, both the melanoma and non-melanoma type skin cancers.
Is that because the skin just has that memory? It's just comes up over the years, moves up through the layers? I know I'm really simplifying, of course.
Right. Well, cumulative damage can occur. We call that photoaging. And when ultraviolet light, which is a highly energetic form of light, hits the skin, it causes changes in DNA. And DNA is the blueprint or the framework by which cells know how to react and build things and grow and develop. And what happens is cancer is caused, one of the ways it's caused is by damage to that DNA. It causes the cells to grow uncontrolled. And we don't want to have that happen. It's like the carpenters building your house. They go with the wrong blueprint. What happens? Your house is not going to stand. So we don't want that to happen to ourselves.
So that's where you often, you talk about like the signs, some thickening of the skin.
Thickening of the skin, redness, things that don't heal. Because cancer cells don't behave like regular cells. They don't heal properly. Bleeding, itching, pain, that sort of thing. That's what you're looking for. You're looking for changes in moles, particularly in ones that you've seen previously, that you've been following. We have something called the ugly duckling. I don't know if you've heard about that in your medical reporting.
No, I haven't, no.
The ugly duckling sign is, if you have 5 freckles and one of them looks different than the other one, well, that's something you should be concerned about, and you need to speak to your doctor about that.
I want to go back to the graphic. I know we had that up just a second ago. Can we look at that again with some of the symptoms? There we go. The rough or scaly red patches you mentioned. They're raised growths or lumps.
Yes.
Okay.
Yes.
And then open sores that don't heal or that heal and come back.
Yes.
How long should you give a spot to sort of heal or not heal? How many weeks or a couple
I generally
months?
recommend 2 to 4 weeks, and then go see your doctor early, because skin cancer is eminently curable if you catch it early. If you delay, and unfortunately we have seen patients who've delayed things, waiting for it to heal or trying over-the-counter medications and things, and that causes a problem later on because of extension of that cancer into deeper layers of the skin.
Deeper layers.
Right.
Prevention. Let's talk about that in our final minute or so.
Prevention is the most important thing. I'm an internal medicine pediatric specialist, so I tell my parents who come in with their young children, any child less than 6 months of age should not be out in the sun. Start sunblock after 6 months of age. For the rest of us, try and stay out of the sun during the damaging parts of the day, from 10 a.m. to around 4 p.m. Wear sun protective clothing, a big floppy hat, long sleeve shirts and long pants. Those can help. And also the use of sunblock, particularly that with an SPF, sun protective factor greater than 30, reapplied regularly.
Regularly, okay.
Every 2 hours or so.
Every 2 hours or so. Probably choose an umbrella if you can find an umbrella to sit under. Okay, and we've got self-tanners, and we've got, you know, for women makeup, you've got self-tanners if you want to look like you've got some color, right?
Yes, yes.
And a lot of those, I don't know that they have SPF, though. So some makeup does. Just read the labels carefully. What's your favorite sunscreen? Can you say just what are the ingredients you need to look for?
Well, there are multiple ingredients. You need to look for one that covers both UVA and UVB. Because those are subsets of ultraviolet light, like we talked about before.
Okay. All right, terrific.
And also wearing sunglasses protect your eyes too. Ultraviolet light can damage the eyes. Yes.
Absolutely. Okay, Dr. Wandass, who's in internal medicine, primary care with St. Thomas Medical Partners. Thank you so much for coming in and educating us here in the middle of the summer.
Yes.
Wear the protection. All right.
Thank you very much.
All right, we'll be back right after this.